Makofi.
It is my pleasure and honor to welcome each and every one of you to Kenyatta National Hospital, and in particular to the launch of the 8th National Obstetric Fistula Medical Camp.
In collaboration with Amref, we rehabilitated and equipped the 2 theaters in this specialized reproductive health clinic. However, these theaters could not be fully utilized due to lack of access to the wards. We therefore decided to sponsor the construction of a corridor linking the clinic and the wards. Your Excellency, thank you very much for presiding over the opening ceremony. This is indeed a very significant development that will enable the use of these 2 theaters for fistula patients and indeed for all other patients in Kenyatta National Hospital.
Amref has been supporting freedom from fistula since 1992, and we have done this in about 8 countries in Eastern Africa through our Amref clinical outreach program. One VVF surgery costs about 55,000 Kenya shillings. And as you may know, most of our population who live on less than $1 a day cannot afford, and you've had the testimony from some of the beneficiaries. Therefore, that's why Amref is in this in partnership with others.
The condition is only one of the numerous maternal health conditions affecting women in Africa. The gravest of them all is maternal death. They die because the health centers are too far, and there is no transport to take them when their labor is too long, leading them to the conditions like fistula. They die because there are not enough skilled midwives available to take care of them and they call for traditional health attendant, which are not. Amref has launched the global campaign called Stand Up for African Mothers. So Stand Up for African Mothers aim to train 15,000 midwives by 2015 to contribute to the reduction of maternal mortality. This campaign would also like to raise awareness of the conditions of work of midwives working in rural areas of Africa in difficult conditions.
If left unrepaired, obstetric fistulas can cause women to constantly leak urine and feces, and as a result, they become social outcasts. I am therefore pleased that this year's theme, Capacity Building for VVF Care in Kenya, seeks to address these challenges by enhancing the capacities of health systems to prevent, repair, and support women with obstetric fistula, and also improve access to and utilization of safe motherhood services. The initiative is taking a stand against one of the gravest dehumanizing conditions affecting our women and a real threat to their dignity. It stands for reclaiming women's dignity as well as protecting families and marriages from disintegrating. We recognize that women and families affected by this condition are deprived of their self-esteem. It adversely affects their social development, leading to withdrawal and depression due to discrimination and stigmatization by other members of the society. It is indeed a pleasure to see that the fight against VVF is gaining momentum with the increased partnership from individuals, private institutions, non-governmental organizations such as Amref, Freedom from Fistula, and the media fraternity. This campaign is a call not only to those who are suffering, but also members of the society who may know a woman suffering from this terrible condition, to share information that this problem can be corrected at no cost. I wish to call upon individual and corporate institutions to come forward and support surgery repair for VVF women so that KNH and Amref can extend free services to some of the inaccessible rural areas of this country. Let us join hands to help these women restore their dignity, to lift their spirits and bring joy back into their lives. We become better people when we look out for one another, and we are blessed when we embrace the notion of being our brothers and sisters' keepers. Asante sana. God bless you.